Hi, I'm Jill Gambill. I'm a coastal resilience specialist at the University of Georgia for University of Georgia Marine Extension and Georgia Sea Grant. I am also a member of our leadership team for the Georgia Climate Project. Thank you all so much for joining us. The Georgia Climate Project is a statewide network launched by the University of Georgia, Emory University, and Georgia Tech. Georgia Institute of Technology to help Georgia reduce risk and maximize opportunities related to a changing climate. We currently have 9 academic partners, which you can see here. And we address key questions throughout the state around climate impacts and solutions. Many thanks to our partners and funders, some of whom are listed here for helping us to facilitate this webinar and produce it. So in today's webinar, we're going to be talking about what does a changing climate mean for Georgia, specifically within the context of health, and what can we do about it. We're building a statewide network to help address and answer these questions. This webinar is part of an ongoing monthly series where we're discussing climate change impacts across a variety of themes. Last month, we talked about coastal impacts. And next month, we'll be discussing the impacts of climate change on Georgia's ecosystem. So hopefully y'all can join us. And I wanted to share a few of the products that Georgia Climate Project has been working on. Please explore these after the webinar. We'd love to have your feedback and participation in generating them. First up, we have the Georgia Climate Information Portal, which is a brand new resource. It's a repository of information and resources and expertise around these themes that we'll be discussing in the webinar. And so fresh up is a brand new page on how does climate change affect Georgia's health. This has key messages. It has some resources where you can learn more specific to the state of Georgia. And we want to thank all of our partners who helped contribute to writing this content. We also have a Georgia Climate Stories series where we explore different topics and challenges, as well as solutions related to climate change in Georgia. And these are, telling the stories of regular Georgians and how they're affected by climate change and what they're doing about it. And we recently helped launch the Drawdown Georgia Solutions for 2030. These are the top 20 solutions for making our state carbon neutral. If you go to this website, you can learn more about the different solutions that have been identified. And there is a whole suite of information on this website. So please explore it and learn more. And then finally, we would love to engage with you all after this webinar. We have a social media presence in the following accounts, and then our website has all of these resources that I've just gone over. So please connect with us and keep in touch. Just a little bit of housekeeping. For those of you who may not have done a webinar on Zoom before, we have 2 options down here at the bottom. This chat, where you can introduce yourselves and have sort of informal conversations, and then the Q&A, where we encourage you to ask questions of our panelists, and we will they can answer you in real time on there, or we'll also be reading out questions throughout the webinar. And once we finish with the webinar, you're going to receive a pop-up screen that will take you to an evaluation. It's very short, only a few minutes to fill out. Please provide feedback. Let us know what you thought. Let us know what you learned and what you'd like to learn about for future topics that we might explore here in the series. So that brings us to the start of this webinar on what does a changing climate mean for Georgians' health. We have a fantastic panel for you today, very stellar experts that we're going to hear from. And our moderator is Rachel Usher. She is currently a project manager for the Georgia Climate Project and Climate and Health Research Incubator at Emory University. She graduated in 2020 with a Master's in Public Health in Epidemiology from the Walden School of Public Health at Emory University, and in 2016 with a BS in Ecology from the University of Georgia. Rachel is a lifelong Georgian, having lived in Savannah, Athens, Dawsonville, and Atlanta. So Rachel, I will turn it over to you now.
Awesome. Thank you so much, Jill, for that wonderful introduction, and welcome to everyone else who is able to join us today for this amazing panel. I'm going to be helping to serve as moderator for the panelists today and help take your questions. So again, as Jill mentioned, we really encourage you to be interactive. And we want to hear your questions. So please, 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 I'll be checking into the Q&A box along with the panelists and flagging some questions that we're going to follow up with. So each of the speakers and panelists today will have some time to talk. And then after each of their talks, we'll have a segment for Q&A, and we'll also be following up at the end for some group Q&A. So please send them in, and let's go ahead and get started with our first panelist. Claudia Brown is a health scientist with the Climate and Health Program at the Centers for Disease Control and Prevention, the CDC. Her work focuses on the human health effects of climate change, including alloallergens and respiratory health effects, extreme weather events, and emerging infectious diseases. All right, go ahead and let's give a warm welcome to Claudia. Thanks so much.
Thanks, Rachel. I'll get my screen shared here.
Looks good, Claudia.
Okay. Am I in presentation mode?
Not yet.
Oh,
we still see the bar on the side. Yep.
Okay, let's give it a minute. So thanks for having me. I'm going to be talking about kind of giving the general overview to kick this off on the health effects of climate change, and specifically with a focus on the Southeast and Georgia. I'm, as Rachel mentioned, a health scientist with the CDC's Climate Health Program. And this program has actually been funded by Congress since 2009. Climate change was identified as an important priority for public health and something that the CDC should address. So as a program, we serve as a resource to other health agencies across the federal government, state and local public health departments, as well as tribes and territories across the U.S.
Hey Claudia, it looks like your slides are still a little strange. So either I would try a different presentation mode, or I'd be happy to help share from my end as well.
Okay, that's not
perfect. Yep, that looks great.
Okay, thanks. Not sure what was going on there. So we're working with public health practitioners to address the health effects of climate change, as well as providing tools, guides, and processes to assess what those health effects are and how to best prepare for those. So climate change is an important issue, for public health, as we see the increase in temperatures and change in precipitation. We're seeing these effects on the environment that have significant health impacts, such as changes in extreme heat, which affects heat-related illness and death, changes in air pollution, which is significant for those with asthma or cardiovascular disease, as well as changes in extreme weather events, more frequent and intense events, which can have varying degrees of health impact, from the direct impacts of injury to the indirect impacts of mental health stress. So I'm going to focus a little bit on some of the impacts that are specific to the Southeast and Georgia, as well as some of the research and work that we've been doing around these topics. So as cities across the Southeast are experiencing both more and longer summer heat waves, a majority of these cities in the Southeast are experiencing a disproportionate effect of that effect. So we're having worsening heat waves across a majority of the cities in the Southeast, which has extremely significant health impacts on populations there. Something that the CDC just launched this summer, and it's a new resource, is it's Heat and Health Tracker. You can actually go down to the county level and see how heat is impacting your county, some of the historic, current, and future temperatures, as well as an interactive map to assess and look at vulnerability and some of the critical infrastructure there. So digging in on this tracker as an example, looking at my hometown in Gordon County, Georgia, you can see that there's a specific profile using real-time data for that county, where you can see what today's temperature is, how it compares to the historic average, and some metrics around that. Air quality impacts are another major concern when it comes to climate effects in the Southeast on health. As we know, the warmer months are when we're seeing poor air quality. In the Southeast specifically, the poor air quality can result from emissions, mostly from vehicles and power plants, smoke from wildfires, and then pollen from trees and plants. Specifically in urban areas, which there's a high proportion in the Southeast, you see with higher concentrations of carbon dioxide, you have that, along with the warmer temperatures, is really stimulating plant growth, but which can be a good thing, but it can also stimulate more pollen in the air. Looking at pollen data in Atlanta, Georgia, from the local pollen station up in Marietta, we have been able to see that the tree pollen season is actually becoming longer as a result of these warmer temperatures. Additionally, we're seeing a higher number of high pollen days. So we're not only seeing that the seasons are becoming longer, but that the number of days that have significant health impacts are increasing. So that top bar, the green, is showing the change in the number of high pollen days for the spring tree season, and then the orange is showing the fall weed season. Extreme events is a significant concern in the Southeast, as we are in a historic hurricane season and about to experience across Georgia a tropical storm. This has significant impacts on not only the health due to injury, but also, as I mentioned earlier, those mental health impacts due to the damage that may be caused to your home. And then also it can affect healthcare facilities and transportation to those facilities. So during these events, it's difficult to get the care that you need. We've done an analysis in Georgia looking at hospitals within flood hazard zones. So the red dots are hospitals within a 100-year flood hazard zone, and the orange are within a 500-year flood hazard zone. So as we know, these events are not happening once in 100 years. or once in 500 years, but they're actually happening more frequently. Specifically looking on the coast, you can see that some critical infrastructure there that is at risk during these hurricanes or extreme events and are vulnerable to flooding. So vector-borne diseases is a concern in the Southeast. We're in one of the more favorable conditions for the Aedes aegypti mosquito, which carries a lot of different diseases, including West Nile virus. And then as we're seeing that earlier spring and the longer and warmer summers, we're seeing that it's anticipated that the cases of these vector-borne diseases will not only increase, but that the geographic range will also broaden. And finally, some populations of concern. So in the Southeast and in Georgia, we have a high proportion of people working in agriculture, forestry, hunting, and fishing sectors, as well as construction and support, waste, and remediation services. These tend to be outdoor work activities, which has a disproportionate effect during these extreme heat events on having a higher number and higher proportion of people with heat-related death and illness. We've done some vulnerability assessments and have a resource on our website to show ways in which you can map these different exposures and indicators and overlay them to get a sense of where are areas of highest concern. And here's some examples in Georgia. So I'll just briefly mention that, it's not all doom and gloom. There's a lot of work that can be done to respond and prepare for these events. The CDC has a BRACE framework, which helps to anticipate the health effects, plan and implement adaptation strategies, and then evaluate those.
You have about 30 seconds, Claudia.
Okay, thanks. And then just to briefly highlight that these are some of the interventions that have been taken on by health departments across the various issues. And for more information, you can actually go to the CDC's Climate and Health website, where we have plenty of guidance, documents, trainings, and communication materials. So with that, I'll stop and answer any questions.
Awesome. Thanks so much, Claudia. And again, I encourage everyone, don't be shy to please hop into the Q&A section if you have any questions for Claudia. But one question I was thinking about what resources or advice does the CDC have for individuals or families to protect themselves when there's some climate-related health impacts that might be impacting them or their community? Are there things that are tailored specifically more towards people responding to different like heat impacts or pollen impacts?
Yeah, that's a great question, and something that I didn't really highlight, but is I think going to be highlighted maybe in the next talk, that how climate change impacts you depends on not only where you are, but who you are. So I think it's really important when going through these events to tap into your local public health office and communications. They're the ones that are tailoring their resources and their information specifically to where you are and what may be experienced. So just to say that, I think there's a lot that we can do as individuals, and awareness and tapping into those local resources is really critical.
Awesome. We did get a question from Hannah Leah that says, hi, Claudia, would you be able to touch on some of the challenges or barriers in implementing the framework, the BRACE framework that you mentioned earlier?
Sure. So the BRACE framework is very much meant to be adaptable. It while it lays out kind of the gold standard of if you have all the resources in the world and you have a very supportive public health office to deal with these issues, then this would be a great framework to implement all of the different strategies. So we're finding that especially some of the local public health departments that are a little bit more strapped on resources, it's very much found that they need to adapt and pick and choose kind of where they're going to focus their attention and their capacity. Additionally, we found that, and speaking to Emory University here, that the academic institutions are really critical in partnering with to not only help better understand how climate change is affecting the local area, but what some of the strategies are for adapting to those. So some of the barriers and opportunities to adapting is kind of partnering with those local institutions and prioritizing where you can put your resources.
Awesome. Thank you so much, Claudia. And I know we have a few other questions coming in, and I unfortunately, I think we have to move on, but we will have an opportunity at the end of the panel today to bring back some of these other questions, but we're going to go ahead. And for time's sake, thank you so much, Claudia. We're going to go ahead and move on to our next panelist. Dr. Linda Walden's mission is reaching out to make a difference in rural Southwest Georgia. A native of St. Albans, New York, she came back to her family roots in Cairo, Thomasville, Georgia. She is a graduate of Florida A&M University and Mercer University School of Medicine. She is the first female physician, Black or white, as well as the first African-American chief of staff at Grady General Hospital in Cairo, Georgia. Upon moving to Grady County, she did a visual assessment of her community and realized she needed to do more than just practice medicine. She is a family physician, visionary, mentor, news columnist, catalyst, trailblazer, motivational speaker on local, state, and national levels, and founder of Health is Life Ministry. All right, let's go ahead and give a warm welcome to Dr. Linda Walden.
Well, thank you very much, Rachel. It's certainly a pleasure to be a part of this panel, and thank you for the opportunity of inviting me to come to address a serious crisis in Georgia, not just in the state of Georgia, but throughout America, that is negatively affecting our health and worsening our environment, and that is climate change. You see, climate change, next slide. Climate change is truly a public health crisis. And all of us have got to do our part to mitigate the causes of climate change, or we're going to suffer more of the consequences. As you can see, 5 million people die worldwide in the US, 250,000 people die each year secondary to climate change. And it's caused by what we are doing in our society. We, the people, are making this worse. We're making our climate warmer. And as a result of increasing global warming, we're having more problems with our weather conditions. Higher ground ozone layers. Now people ask, well, what are ozone layers? The ground ozone is the bad ozone. The stratospheric ozone is the good ozone. The stratospheric ozone is in the upper atmosphere. And that's what protects us from the shield of UV rays of the sun. However, with ground ozone, which is lower, it's similar to what you would see as smog. That's air pollution. That's coming from all of the fossil fuel emissions that we're putting into our environment from all of our vehicles, whether it's cars, trucks, buses, trains, planes, you name it. All of those fossil fuels, the CO2, the nitrous oxygen, the sulfur dioxide, the methanes, that's what's making it hotter. That's what's trapping it in our temperature, causing the heat waves that we see. And you all know this summer we had some severe heat waves in Georgia that came through in the 100 degrees. We're seeing more hurricanes and storms and floods. In the West Coast, you see more wildfires. But as a result of these weather conditions, people don't realize they're affecting our health. They're making the conditions that many of us already have, such as hypertension and diabetes, heart and lung disease, cancer, sickle cell, and Lord knows stress. Stress is worse now than ever with the COVID-19. All of us are experiencing it in some degree or another. It's 78 to 80% of the doctor's visits to the office are related to stress. And unfortunately, All of these factors disproportionately affect minorities, Blacks, causing 5 times worsening the illness and death with COVID-19 compared to whites. A common cold in whites is pneumonia in Blacks. So racial and health injustices gotta stop because Black top lives do matter. And yes, I've seen it said that, yeah, all lives matter, but not so. If you're gonna have these disproportionate increases affecting minorities, Blacks and Hispanics, then it is not so. All lives will not matter until Black lives matter. So remember, it's not the words of our enemies that's the problem. It's the silence of our friends. So we've got to do what we need to do. For health, happiness, and well-being are linked to a healthy environment and economy for a thriving society. Now, in our country, the US is the 12th wealthiest. We're in the 12th wealthiest countries in the world, but we're only number 38 when it comes to the healthiest country in the world. 29 million people in America without access to health care. The wealthy are among the top 1% in the US population. The rich become rich and the poor become poor. So we've got to end the racial, health, environmental, and social inequities if we're to be an American democracy. For improvement of our health, for clean air, clean energy, is going to start with each of us. Next slide. Now, climate change impacts the social determinants of health. And you might say, well, what are those social determinants of health? It's where we live, work, play, go to school, worship. And it takes a village to improve climate change. And we should not just be a part of the village, but just what are we doing in the village? You know, we have to change the way we live. We have to shape our health and behavior. We can't tolerate ignorance. Many Blacks and Hispanics live in poverty. They work as essential workers, believe it or not. These are essential workers are people who are care workers, who keep the lifeline of America going, who keeps our economy going. They're not just only healthcare workers, and God, we thank you for all our healthcare workers on the front line, but essential workers are those who are farm workers, who are working in the fields, those who are factory workers, sanitation workers, those who deliver our packages, who keep things going. Many of them live in poverty. They make less than $10 an hour. They get unequal pay, and they have the same job and educational levels as whites and still get paid less. Essential workers can't telecommute. They can't work from home. You can't work from home if you got to get out there and pick those vegetables. You can't work from home if you got to be in that factory to make sure those meats and other things are processed and done. So understand, many of these people who can't telecommute, they don't have insurance, they can't afford the insurance premium, they don't get paid sick leave, and as a result, they suffer more of chronic diseases, as I mentioned before, and they don't live as long as whites. Social distancing that we are definitely wanting everyone to adhere to is not the same as social disengagement. We have got to engage, to do more, to make our country better, cleaner, healthier. And as President Obama has so eloquently said, we are the change we want to see. So it's time for each of us to get involved, and we got to make a difference. Because you see, climate change, it impacts our health by the air we breathe, the water we drink, the food we eat, the weather conditions we experience. Next slide, please. And with all that global warming of air, fossil fuel emissions in the air, increasing the temperature and ground ozone levels, it's just making our lives worse. Human lives are at stake more than ever. And now we have COVID-19 pandemic. Lord God help us. Too many of us have died. And now this year, in this time of the year, the flu season is starting. It's time, you should have already had your flu seasons by the end of this month. It's the best time to get them is in October, September, October. So please, please, if you haven't, get your flu vaccines. I don't want to hear, oh, I don't want to get the flu vaccine because I'm going to get the flu. No, you're not going to get the flu. Okay? Please wear your mask, social distance, wash your hands with soap and water. This not only protects you, but it protects your loved ones that you're around during the day and other people that you work with, especially those with pre-existing diseases. Many young people especially are not adhering to the rules. So they're putting the lives of many others, their loved ones and friends and associates at risk to get infected, may have to be hospitalized, put on a ventilator, and many may not make it and die. So we can't let our guard down. COVID-19 has caused 220,000 plus deaths and over 8 million people. And I have to say, You know, it didn't take long. When we first found out about COVID-19, it took only 3 months in the US to get 1 million cases, 3 months to get 1 million cases of COVID-19 of people being infected. And in 6 weeks, we doubled that in America because we did not prepare and do our job of what we needed to do. We were not informed appropriately. And as I mentioned before, over 8 million deaths test positive now. And in the state of Georgia, 7,500 deaths and 330,000 cases plus are positive. Majority are Black, and combined with extreme weather conditions, it worsens our recovery. So please adhere, wear your mask, social distance, hand wash. We must have health equity. Now people say, well, what is health equity? Health equity is when everyone has a fair and just chance, an opportunity to be as healthy as possible. But unfortunately in America, we have health inequity, and that's due to systemic racism, whereby many working class Blacks and Hispanics lack access to health care. They're mistreated, they're undertreated, some are not treated at all, they're underpaid, they're undervalued, they're underappreciated, as well as there's lack of trust by many of them in the healthcare system because they haven't been treated like others. They haven't been given that quality healthcare. So as a result, health equity leads to health disparities. We've got to right the wrongs and eliminate that among people of color. We have to have universal health care. That's why we're in number 38 when it comes to healthiest people. We don't have universal health care. Spain, Italy, Japan, Switzerland, Iceland, they're all in the top 5 because they have universal health care. We've got to vote this year. We've got to vote in the next few days if you haven't. We must mentor and increase Black physicians in our communities, especially male Black physicians. There are over 900,000 physicians in the country. 516,000 are white, 63,000 are Asian, 53,000 are Hispanic, and guess what? Only 45,000 are Blacks. Blacks are undertreated, mistreated, misdiagnosed many times, but we do know one true fact, and that Blacks have better outcomes when they're treated by people who look like them. We must get rid of all this bad media and the billboards and TV commercials promoting cigarette smoking, alcohol, and fast foods, and promote exercise, healthy living, and decreasing the spread of COVID-19. Avoid running and walking in high traffic areas. And I see this all the time when I'm driving on highways near the shopping areas. You see people running and walking along those. They're inhaling all those CO2 emissions and fuels that's causing our air pollution. Go to other areas, the tracks of schools and walking trails at parks. And we need equal pay for equal jobs and paid sick leave for all. Increase job promotions for those who deserve it. I've seen too many patients tell me how they've worked in jobs and they've been working there for 20 years and they will bring in someone new who happens to be white, and he has to train the white person to be the manager when he should be the manager. That should stop. We must continue to get tested for COVID-19. Please, everyone get tested. Get your flu shots. We got to contact our elected officials on local, national, and state levels to implement stricter laws when it comes to cleaner air. We've got to get them to get onto these power plants and refineries and factories and as well as the automobile companies who are making the emissions of fuels, putting out the CO2 and the sulfur dioxide and nitrous oxide worse in our environment. We got to come to a solution, y'all, because if we don't, we will continue to be part of the problem. Next.
Thank you so much, Dr. Walden. That was wonderful. We do have a question from the audience from Paul Schramm. How can health departments in Georgia who have very limited resources ensure the health equity guides their work? Are there steps that all Georgians can take to help justice, equity, diversity, and inclusion to be the bedrock of climate and health activities?
Well, health departments are doing a good job as it is. They're trying to make sure people get tested, number one. They're trying to promote, prevention. But the problem is we, the citizens, are not all doing what we need to do. We have got to do our part. We've got to, first of all, get access to healthcare for so many people who don't have it. And that's the serious problem. They don't have access to healthcare. There are language barriers with Hispanics. That's another problem. When they do get health care and they go to the doctor, they don't half understand what's being said to them. That's a serious problem in America. And then the other thing, they don't get treated the same. They don't get the same type of medications. tests that need to be ordered, screening. I cannot tell you how many patients I have seen as an African-American physician in South Georgia, in rural Georgia, that have told me, Dr. Walden, you're the first doctor that has ever examined me, but put your hands on me and gave me a complete physical. And I was just shocked and in tears. That's terrible. I couldn't believe this was happening among colleagues, doctors. We take an oath when we get our degree, a Hippocratic oath to do no harm. That should not be happening. And I've heard it more than once. This has got to stop. We have got to be held accountable to, yes, on every single level. I wanted to mention, if you want me to complete that, I can.
Say that one more time. My audio cut up for a moment.
Then I'll be finished.
Okay. One other question that I wanted to mention, you were mentioning some barriers to equitable access to healthcare. So I was wondering if you could talk a little bit more about what barriers that exist already for Black and Latinx Georgians who are seeking healthcare with COVID-19 crisis and also with all of the health burdens that climate change brings.
Well, first of all, as I mentioned before, lack of trust is one problem. Not having access to healthcare and not being able to afford the health insurance. That's the seriousness of this problem. Most of these people work minimum wage jobs, and the amount that the premiums cost for the health insurance is not even what they get paid for when they get a paycheck. It doesn't even equal that amount. So that lets you know how bad it is. That's why I'm really pushing that our government will change and have universal health care, or either help with the Affordable Care Act continuing to help those who can't afford it right now, because this is serious. This should not be happening. These are essential workers out here keeping our lifeline going. And this is how they're being treated. They can't even afford health insurance because they don't get paid what they should be getting paid. This is not right. This is part of the health equities, communicating with them. Many of them go to doctors and they come to me, and I make sure I have someone who can translate, or bring a family member who can translate for them if I don't have one in the office, so they understand what I'm saying. I try to make sure I give them education in their Spanish in Hispanic language, so they can, understand what I want them to do when they go home to treat their illness, whatever it is. Not enough education is being done to help our minorities, people of color. So communication, language barriers, not having access to healthcare, not being able to afford the insurance. Patients feel doctors don't listen to them. They don't understand what they say. And we need to make sure our students who are going to become physicians in medical school receive training in this, because this needs to be addressed. It's a lack of confidence and trust in many of our healthcare providers. And this should not be happening in America. There's a healthcare quality divide. And the greatest risk is eliminating these barriers. That's what we need to do.
Well, thank you so much, Dr. Walden, for speaking on this topic today. And I really do encourage all of the attendees to please keep submitting your questions. We're going to have a chance to come back to our panelists at the end. And this equity framework is a really critical way to look at public health and climate change and what it's going to mean for all communities and all Georgians. So thank you so much, Dr. Walden, for your words. And we're going to go ahead and move right along to our next panelist. But thank you so much. All right, so next we have Dr. Becca Philipsborn, and she is a primary care pediatrician at Children's Healthcare of Atlanta and Emory University, as well as a founding member of the Georgia Clinicians for Climate Action. At Emory, she is an associate director of the Pediatrics Global Health Track, a member of the Southeast Regional Pediatric Environmental Health Specialty Unit, and a working group member of the Lancet Countdown for Health and Climate Change US Brief. She previously worked on climate change in food insecurity and malnutrition in West Africa at the United Nations World Food Program before returning to academic medicine and clinical care. Her scholarly work focuses on implementing climate change education in the medical school curriculum, as well as impacts of climate change on children's health. She completed her medical school and residency training at Emory University, holds an MPA in Environmental Science and Policy for Columbia's Earth Institute program, and an AB in English from Princeton. Let's go ahead and give Dr. Becca Philipsborn a warm welcome.
Thank you so much, Rachel, for that introduction. Thanks to all of you for being here, and big thanks to Dr. Walden for her talk there and for being a source of inspiration to me every day. As Dr. Walden mentioned, we see the health impacts of climate change as physicians every day. And the outcomes of our patients, and particularly our patients of color who will be disproportionately harmed, are not going to be as good as they could be if we don't teach current and future doctors how to recognize and treat those impacts of climate change that we see in our practice. So that's what I'm going to focus on a little bit today. So the good news is there's incredible momentum in this area. Doctors and healthcare workers are really mobilizing in this space. Just this last June 2019, the American Medical Association called for teaching physicians about climate change at every level. So during medical school, during residency training, and those physicians who already have their license to practice and through continuing medical education frameworks. That same month, this US call to action on climate health and equity was released. It really said, this is a health emergency. This is one of the greatest threats to health America has ever faced. And it also said, but there's incredible opportunity here to deliver immediate and sustained health benefits and reduce future health risks from climate change if we make those changes that we need to see anyway. And this call to action has been endorsed by 70 health institutions, including the American Academy of Pediatrics, American Medical Association. And physicians see that space. We have this incredible privilege of talking to patients every day about things that are good for their health and that are good for the health of the planet as well, things that make them healthier. So what have we done here in Georgia? How are these calls to action being heeded in our state, and what else can we do? So I'm going to walk you through some of the activities at these different levels for practicing physicians, for resident trainees, and for medical students. So just last February, the American Academy of Pediatrics Georgia chapter was the second after the state of Montana to have a state resolution recognizing that climate change is a health emergency for the children of Georgia. This is something that we know that because we're in those clinic spaces, we can't be at every meeting for the state of Georgia about policy, about climate change. So this is something that is meant to empower our colleagues in this space to make sure that health is represented at the table and that the health of children, the health of our patients are represented at the table in discussions about climate change in the state of Georgia. We also, as of this past May, we formed kind of like early in 2020, but in May, we got our website up and running. There is a Georgia state chapter of the Medical Society Consortium on Climate and Health. The Georgia chapter is called Georgia Clinicians for Climate Action. Dr. Walden and I both sit on the steering committee for this organization, and this group is meant to educate the public and fellow healthcare workers about the health impacts of climate change in Georgia and raise our voices, make sure that we are representing our patients in these discussions. The website is there, and I'd encourage you all to take a look. Now, on the resident education side, just this past September, this piece was published in the journal Academic Medicine, talking about how we as physicians who practice and who teach residents can start incorporating these health impacts into a clinical framework. So we talked about how climate change harms health. These are things that we already see in Georgia every day, how it harms the health of our patients. We talk about how climate change requires us as physicians to adapt our practice. And that may mean for a high school athlete who comes to you needing a sports physical, that you talk about the risk of heat-related illness, especially in full football gear, that kind of thing, in preseason training. It may mean that you screen for the exposure risk for your patient, what their occupational exposure risk is, are they outdoor workers, for pregnant women, and that you also screen for those who are already more vulnerable because of existing chronic conditions. So for the doctors in the audience, think about how many patients we have who are dependent on a daily dose of a medicine and what our role is in making sure that they are prepared if there is a climate-related disaster that strikes and they're not able to access their normal daily routines. And climate change also disrupts healthcare practice. Now, Claudia talked about the extreme weather events and floods along the coast of Georgia and what that means to access to healthcare. But we've learned that it's not just when our facility itself is in the pathway of disaster. The Google map shows the evacuation route from Hurricane Irma when more than 7 million people were under evacuation orders from Florida. You can kind of see where they went. They went to Georgia. And then the Guardian article there is about when supplies were disrupted from Hurricane Maria. And the FDA monitored shortages of 90 medical products, including 40 critical medicines. These are things that we had to adapt to in our hospitals and in our clinics and do without. That's no longer so hard to imagine right now. Coronavirus has definitely given all of us in the healthcare workforce a sense of what it means to have your supply chains disrupted and why a resilient medical supply chain is critical. It's been another preview in this space. So how about on the med school level? So speaking of coronavirus, it disrupted medical education as well. This past spring, all of our clinical students were pulled out briefly from clinical rotations because we did not have adequate PPE or protocols to protect them in this new pandemic phase. So at that point, I put together an elective called the Climate Crisis in Clinical Medicine Virtual Elective. Because of our new virtual reality, we were able to invite top speakers from all over the country to present to students on the health impacts of climate and why it matters for the practice of medicine. These are all available online, hosted by Emory's Office of Sustainability Initiatives for other schools and students to learn from as well. And then just this past couple weeks ago, two fabulous students, Ben Raven and Emmeline Laney, were co-first authors on this piece about the role of our students themselves in catalyzing this education. Students want to know about these health impacts because they see that they are going to be the front lines. They are truly the future of the practice of medicine. And we are talking about needing to get to a net zero carbon emission planet by 2050. That is when they are going to be in the primes of their practice. They know that they are going to need to be prepared for the health impacts of climate change that they will see. So this article details how we have approached this problem at Emory University and thought about incorporating climate and health education attached to those subjects that med students already learn about anyway in the first 2 years on human pathophysiology. And then finally, this can be, as Claudia mentioned, this can be doom and gloom, but there is so much hope. And my hope comes from patients. It comes from young people. It comes from those who are saying, hey, you guys get your act together and take care of us. And children are very powerful advocates. So I consider my role now as advocating with them, not just advocating for them, and making sure that we do right by them and protect their health for their future. That's it, and happy to take a couple questions.
Awesome. Thank you so much, Dr. Philipsborn. I did have a question for you. Coming from this, you have this immense amount of expertise in sharing climate-related health impacts with patients and their families. What are some of the challenges that you face in a clinical setting when you're having those conversations about climate and health?
It's not so much challenge, it's making it relevant for the patient in front of you. So if I have a patient who suffers from severe allergies, that's what I'm going to talk about in relation to climate change. If I have a patient who is a technology dependent patient, so they have special medical technology that they need or rely on, or if they have a heavy burden of chronic illness so that they really need to have an emergency preparedness plan in place, that's what I talk to with them about climate change, and just making sure that you, like everything we do, this is something that we need to use a patient-centered approach and talk to our patients from where they are. I think one of the most exciting things is in just a regular routine well visit, talking to patients and families about what they need to do to be healthy anyway, talking to them about what their daily routines are and finding a way to kind of find common ground there in the climate space. That's something that we can do every single day in our practice of medicine. It's important for our patients at an individual level for their individual health, and cumulatively there can be some public health impact there too.
Awesome. We do have a question from Laurel Hayslip in our audience. How are you seeing specific health impacts of climate change present in the pediatric population, and what can pediatric healthcare professionals do about it?
Yeah, so I love the cover of the Rollins magazine that was shown briefly in my slide. It said, "This is the face of climate change." And it was a young African-American boy with a nebulizer mask up to his face. And I think in terms of children, respiratory illness exacerbated by heat and pollution is the most common thing that we see in pediatrics. It's certainly not the only thing at all, but it is something that we see. So a practical point there would be when I am talking to my patients about asthma, a lot of patients haven't thought about heat and air quality index and as a part of their asthma action plan. Yet we give every patient who comes to clinic with asthma an asthma action plan and update it anytime we make any changes to their medicine or to their care. So we can talk about, hey, this is how you access daily air quality index. This is when it's probably not as safe for you to be playing outside. And maybe for these days where we know the air quality index is going to be bad, if you're able to get outside early before we have as much ozone concentration, just providing access to information for patients to be able to protect themselves and to fit this framework into their care plan, because we know we're going to have more extremely hot days. We know our air quality is going to get worse. And these are ways that we can make a difference as pediatricians.
Awesome. All right. Well, thank you so much, Dr. Philipsborn. And again, I encourage people to continue submitting their questions, a wealth of knowledge here on both education and pediatrics. Thank you so much, Dr. Philipsborn. We're going to go ahead and move on to our final speaker. So Lieutenant Colonel David DeGroot, PhD, is the director at the Heat Center at Martin Army Community Hospital at Fort Benning, Georgia. He directs efforts aimed to prevent heat casualties through education and training, develop and share medical management best practices, and to conduct clinically meaningful research. Lieutenant Colonel David DeGroot's research focuses on environmental physiology, injury prevention, and human performance optimization. He is a member of the Society of Federal Health Professionals, the American Physiological Society, and is a fellow of the American College of Sports Medicine. His education includes a BS in physical education at SUNY Cortland, an MS in exercise science from the University of New Hampshire, and a PhD in physiology from Penn State. The author of over 80 research articles, government and technical reports, book chapters, conference presentations, Lieutenant Colonel DeGroot has received research awards from ACSM, Environmental Physiology Interest Group, and the APS Environmental and Exercise Physiology section at the Army Public Health Center. Let's go ahead and give a warm welcome to Lieutenant Colonel David DeGroot.
Thank you very much, Rachel. Well, that intro sounds like it makes it sound like I know what I'm doing a little bit there. Yeah, so you can tell from the intro and where I went to school, I'm not a native Georgian. Actually, like Dr. Walden, I'm actually also a native New Yorker. Have been in Georgia for about the last year and a half now since the Army has stood up the Heat Center at Fort Benning, which is what I'm going to talk a little bit about today. So we can see my slides okay, Rachel? We're good?
Yes, your slides look great.
Okay, good. Just wanted to make sure before I got ahead of myself that we were actually seeing my slides. Okay, so how come my slides won't go? There we go. That's how I advance my slides. All right. So first, I want to tell you a little bit about Fort Benning. One of three Army installations in the state of Georgia. Of course, there's also Fort Gordon over in the Augusta area and Fort Stewart in the Savannah area. Here at Fort Benning, so this is the home of the Maneuver Center of Excellence. So the Maneuver Center basically trains if you are an officer or enlisted service member undergoing your initial entry training. You're just coming into the military and you're going to go into either infantry, armor, or cavalry. You come to Fort Benning for your training. We have about 11,000 permanently assigned military personnel like myself, and then on any given week, over 16,000 trainees are at Fort Benning, totaling over 80,000 trainees a year come through the gates of Fort Benning for basic training, Ranger School, Airborne School, all sorts of other training activities that are essential for the generation of our operational force. Being that we're in South Georgia, we have a significant heat illness burden. So these data, first I want to introduce the publication. Medical Surveillance Monthly Report is a publication of the Armed Forces Health Surveillance Branch. This is mostly a civilian audience. think in terms of the Armed Forces Health Surveillance Branch is basically the Department of Defense's version of the CDC, and the Medical Surveillance Monthly Report is our version of the Morbidity and Mortality Weekly Report. In our case, it's a monthly publication, and this is from this year's annual update on heat illnesses. The figure on the left indicates that basically not just in the Army, but the armed forces, all 4 services, we have about 500 heat stroke events per year. Additionally, we have over 2,000 heat exhaustion events per year. And as you can see, the table on the right at the top of the list for leading the number of heat casualties of all kinds is Fort Benning, where 15% almost of all heat casualties in all of the Department of Defense occur at Fort Benning, owing to the combination of the high heat, high humidity, and the high intensity military training that we're conducting there. Before I get into what we're doing to help mitigate the effects of heat stress, I do want to point out that actually the U.S. Army has a long history here, going back almost 100 years. In the 1920s, the Harvard Fatigue Laboratory was founded, created, and a lot of its funding came from what was then called the War Department. A seminal text in the area is Physiology of Man in the Desert, all done under contract to the Army. And there's been some Army-specific research labs. The Army Medical Research Lab and the Climatic Research Lab later merged to become the Research Institute of Environmental Medicine, which is actually where I started my career, first as a research assistant and then later as a research physiologist after I earned my PhD. And they continue today doing some really excellent basic and applied science research on heat stress on human health and performance. One of the things as a result of all this military research actually dates back to the 1950s and at Marine Corps Recruit Depot, Paris Island, where 2 Navy physicians created what's now called the Wet Bulb Globe Temperature Index. And this is the standard index that we use in the Army. Well, not just in the Army, but in the armed forces. The other services do as well. We don't use the heat index. The heat index tells us how a given set of climate conditions feels. This into one metric defines the heat strain of the environment. And this is what we use depending on what the Wet Bulb Globe Temperature Index is, what heat illness mitigation procedures progressively get put into place. And you see on the lower left there where I've circled just the different heat categories and the temperatures with that. You might think they're a little bit low, but the WBGT is weighted heavily towards the natural wet bulb, which is an index of the water vapor content of the air. It's always going to be lower than air temperature. So don't get thrown off by the actual numbers there. And what I've done is, for this presentation, I wanted to share the impact of climate change now here at Fort Benning. So what this figure shows is some data from the Air Force Weather Squadron at Lawson Army Airfield. So that's right next to, it really is part of Fort Benning. If someone comes to Fort Benning for airborne school to jump out of a perfectly good airplane, Lawson Army Airfield is where they're going to take off from. And there's a weather station there. So they provided data going back to 2008. And what I've plotted here is the number, if you look on the y-axis, the number of hours per year that we were in each heat category. And what I really want to point out is those dotted lines are the trend lines. They're almost all trending upwards. Year over year for the last decade plus, the number of hours of each heat category have increased. The outlier is at the bottom of the slide there. That's actually heat category 5, the most extreme heat category, and it's oddly trending down. And I think it's actually because 2008 and 2010 were abnormally high values. And if we took those out, actually that trend line changes direction and is going up. But nonetheless, though, that's what the data is showing us. So certainly the climatic stress that we feel here at Fort Benning is certainly not getting any better, as we show here over the course of the last 10 years or so. So what can we do? The Heat Center was established basically as an ad hoc effort in 2016 after we actually had a tragic death in a trainee, heat related. But this wasn't sustainable. This was busy clinicians doing what they could with no relief from their normal clinical responsibilities. And of course, that sort of approach isn't sustainable. So in 2019, a formal effort was approved with myself as the director, and I've got several support personnel. We've established our heat clinic. This website is actually the parent. It's the Uniformed Services University. It's co-located at Walter Reed National Military Medical Center. So of course, if you're paying attention to the news where President Trump was taken a few weeks ago and he had coronavirus, it's co-located on that same campus there, otherwise known as America's Medical School, Uniformed Services University. Within that, I've got some collaborators there, and we've established our website that has treatment algorithms for heat illnesses, prevention policy documents. A number of our research papers are all available on that website. And really what we're trying to do falls into 4 different lines of effort here. First and foremost is prevention. Earlier this week, I was out at one of the training brigades providing training and education to new drill sergeants. They just finished the U.S. Army's drill sergeant school. They come here to Fort Benning to serve as drill sergeants for the next 2 years. What do they need to know in terms of prevention and then the immediate first response to a heat casualty event? And that leads into talking about what we do with management. Outside in the civilian world, outside the military, heat stroke mortality is around 3 to 5%. Here at Fort Benning, it's less than 0.5%. That's an order of magnitude better. So we know what we do here works. So our prevention is making sure that new personnel coming to Fort Benning know that, but it's also getting that information out there to providers and first responders at other installations besides Fort Benning, because we don't have a monopoly on the heat casualty problem. So we want to share those lessons learned and share those best practices. Given the large number of heat casualties we have here, we want to leverage that to conduct clinically meaningful research. I mentioned earlier the Army Research Institute of Environmental Medicine. They're located up in the Boston suburbs. Tremendous history of countless, literally, it's an exaggeration to say hundreds of publications in the area of heat and cold stress effects on human health and performance. They don't have access to that clinical population to do clinically meaningful research. For example, one of our challenges is, say we have that unfortunate event where a soldier has an exertional heat stroke event. The question of when is it safe to return that soldier to duty? We don't want to return them to duty too fast before they're fully medically recovered, but at the same time, we don't want to keep them on a restricted duty status for unreasonably long amount of time. They're a trainee, needs to get back into training. And we do need to be mindful of, yes, this is a person involved, but it's also, when it comes to military training, taxpayer dollars. So there's a balance there of when is it safe, but not excessively too long, to return someone to duty. And that's actually one of our current areas of research. And then lastly is policy. We've got a lot of evidence-based knowledge we disseminated here, translating it into actionable policies and procedures that not just the units across Fort Benning can use, but at Fort Stewart and Fort Gordon here in Georgia and elsewhere across the Department of Defense. So that's really what we're trying to do here. We recognize that 2 things, the climate change is real, the problem's only going to get worse, and yet we have the mission to train soldiers. And to do so, they have to work hard. They're wearing protective gear, they're working hard year round. We are going to have heat casualties. That's unfortunately an accepted cost of doing business. What we really are focused on is minimizing the severity. We're okay with heat exhaustions. We're not okay with heat strokes and deaths due to heat stroke. And that's really where we are focusing our efforts, is to minimize those types of events. So that concludes my presentation, and I'd like to open it up to any questions.
Awesome. Thank you so much. I did have a question for you about, so you talk about Fort Benning as this sort of hub of activity for training recruits throughout the U.S. Army. So when you're working and educating with recruits, what are some of the biggest misconceptions about heat illness and heat exposure that you work on sort of debunking with some of your recruits?
Oh, that's a great question, Rachel. Thanks for that. I think really one of the biggest misconceptions is the role of hydration status.
Mm.
That especially the sports beverage industry, and I say this as a guy whose PhD was partially funded by one of those sports beverage companies. We've really driven home the message of hydrate, hydrate, hydrate. And it's not quite as important as the industry would like us to believe. So a couple of things that we won't argue. Dehydration absolutely will impair physical performance. So if you have a given performance task you need to do, whether it's a run or a road march or some other sort of physical event, if you're dehydrated, it's going to impair your performance. Impaired performance doesn't necessarily mean elevated risk of becoming a heat casualty. Yes, to some extent for heat exhaustion, but there's very little data in the literature that shows that, and I'm talking mild dehydration, 2 or 3% body weight loss dehydration at most, elevates risk of becoming a heat casualty. Yet I joke when I talk with trainees or with drill sergeants, you can go into the post exchange here in Fort Benning where you can find those like the reusable water bottles, and some of them have the logo printed on them, hydrate or die. And, it's just this overemphasis on that messaging. And the fear is that you become so focused on that messaging alone of, oh, are they hydrated? But there's so many other things. Medication use. Is the individual sick? What's their heat acclimatization status? What's their physical fitness level? That all play into their physiology on a given day that might elevate their risk. And it's not just hydration. We spend too much focusing just on that.
Well, another question I have, I've lived in Georgia and I used to be an avid soccer player, and I think back and reflect on like some of my time spent outside in the summer, and I'm like, wow, I wish I had known some of like the sort of key things to look for. So I know we have a lot of medical people on the phone, but we also have a lot of people who are just part of the general community. If people are out about doing their day-to-day lives, going to sports events, running, exercising, what things would you flag for them that are real warning signs that this could be a really dangerous situation for like a heat event that could really impact themselves or a loved one?
Yeah, another great question, Rachel. So the key signs and symptoms. So when we talk about serious heat events, we're talking heat stroke, and we're talking hyponatremia, which that's water intoxication. Those are the people who either overhydrate much more than their needs, or you'll see that in real long duration events, like I'm talking triathlons and ultra marathons, where their sodium losses are not replaced. So they're replacing water but not replacing sodium, and they gradually, both heat stroke and hyponatremia are characterized by central nervous system dysfunction, altered mental status. If that person is not oriented to person, time, or place, that's a big red flag. When I train the drill sergeants, if you've got a private who doesn't remember, and this is just something every soldier knows, what's the last 4 digits of your social security number? Because you're asked for it every day. Or what's your unit? Or what's your mom's maiden name? Things that any one of us can quickly and easily recall. You don't have to think much about that. The answer's right there. If you have someone who you suspect is altered, and one of the physical signs during an event, ataxia, so this lack of muscle coordination, I describe it as baby deer legs. And we all know what that looks like. You get that baby deer who's trying to walk and they're wobbling all over the place. You see a person doing that, that's a red flag. Now you do a quick mental status check. If they're not altered and if they're not alert and oriented to person, time, and place, you have an acute, serious heat stroke event in progress, and you need to react now. And that's what saves lives. It's not what we do at the hospital. It's what those drill sergeants do in that immediate prompt recognition that is why our mortality rate here is so low compared to the general population.
Awesome. Well, thank you so much, Dr. DeGroot, for all of your answers to these questions. And I do want to go ahead and invite all of the other panelists to join us back, and go ahead and turn on your cameras and audio. I think we're gonna try to open this up to sort of a broader conversation across all of our different panelists. And please, participants, I encourage you to answer any other questions. I'm going to bring back some that were asked earlier that are just some great questions in the thread. Awesome. Okay, let me go ahead and take a look. So one question that we did have was from Dr. Marilyn Brown at Georgia Tech, who has been helping to spearhead the research effort on Drawdown Georgia. This was mentioned earlier in the slides. It's this initiative to come up with some of the most important impacts of climate change and the solutions here. What are the most important solutions here for Georgia? And her question was, has anyone monetized the public health costs to climate change in Georgia? I know we sort of have a broad audience here, and it's a specific question, but I just wanted to pose it to the crowd to see if anyone had any ideas or resources.
Yeah, and Rachel, if I could chime in, because we actually have done a little bit in terms of with heat casualties. The Army's looked at, they always look at this on return on investment and what's the cost of stuff. That just published earlier this year, actually in that same Medical Surveillance Monthly report, was an estimate of the direct medical care cost of treating a heat stroke casualty. And then there's other data estimating the indirect costs. So that lost duty time, that soldier's still getting paid, but they're not doing anything because they're having to recover. And based on the number of heat casualties we have per year, heat illness costs the Department of Defense about $30 million a year.
Wow. Wow. And that's just yeah, that's, thank you. Yeah, absolutely. Anyone else have any other resources or ideas to share? Dr. Philipsborn, go ahead.
Yeah, this is a little more limited than the total public health impacts, but there was a study, I think a case study last year that came out looking at the economic impact of potential hospital evacuations along coastal Georgia. Marilyn, I can find that reference and send it over to you. So those hospitals that are just along the coastline, if they were required to evacuate, what that looks like in terms of $1 billion plus impact.
Awesome. Thanks so much. Ongoing discussion with Drawdown Georgia and all the resources I know that team would definitely appreciate. One question I did want to sort of to zoom back out a little bit and just open up the floor for a little bit of discussion among all of our panelists. Both Dr. Philipsborn and Claudia mentioned how climate change can feel very daunting. It's this overwhelming issue. It can almost feel too big to act on it. But I think we have had a lot of great discussion today about what people are working on and what steps can be taken today. So what climate change solutions for both mitigation and adaptation would you propose for Georgians? Or what, if you could draw up a world in which you could see any action be done, what would you think would be some of the most important first steps to addressing this? Because as Dr. DeGroot mentioned earlier, prevention is one of the key steps here in preventing loss of life, injury, all of those other things. Yes, Dr. Walden.
Yeah, first of all, as I mentioned before, and I continue to stress, we must make sure that everyone has access to health care. If they don't have access to health care and they're involved in jobs that require them to be exposed to extreme heat temperatures, they're not going to be around much longer. Okay, so we've got to do better, because most of these people will make their doctor's offices the emergency room. That's where they end up, because they don't have insurance to go see a private doctor. So they end up in the emergency room. Hospitals are going to lose money because these people don't have money to pay for their visits in the emergency room. And that's why we're already seeing hospitals in rural Georgia closing. Now, until we do something about that, we're going to have a serious problem in Georgia. People are not going to have access to health care because their hospitals are gone. They're going to have to travel 50 miles or more to the nearest hospital, and there are going to be more deaths. This is easily preventable if we get access to health care and give these people what they need. And this has got to stop.
Thank you, Dr. Walden. Anyone else have any words on things that you would like to see addressed or implemented in Georgia to mitigate, adapt to a changing climate and the health impacts that it poses?
We also need renewable energy. We need renewable energy in the form of solar panels. To decrease the fossil fuels, we need to put stringent standards on these auto companies, these factories, refineries, to stop putting out all of these emissions that they're putting into the air, polluting our environment. And if they don't do it, they need to be fined or taxed even more. Right now, taxpayers are paying for a lot of this problem, and this should not be happening. It should be the opposite way. We need to have people using more energy efficient appliances in their home, LED bulbs. And now, you know, they're coming out with electric cars soon in another year. So if you're able to, next car you buy, make an electric car, then you don't have to worry about all those fossil fuels going in the air, because the more CO2 that's in the air that comes from the fossil fuels, from the exhaust from your cars and automobiles, the more pollution we're gonna have. And stop cutting all these trees down in Georgia. Got too many trees being cut, pine trees, oak trees. Trees absorb the emissions, the pollution. When you cut them down, it's just going to make matters worse. It's going to cause more flooding. Trees absorb water when you get heavy rains and storms. So deforestation, which is cutting of the trees, needs to stop. And I know they do it to clear land for farming and other means, but hey, if we continue to do this, we're going to have more of a serious crisis, and we're not going to be able to fix it.
Absolutely. Thank you so much for raising those points. It's amazing how everything is connected back to health. All of the activities we do, how we transport ourselves, how we use our land, it all ties back to the health and well-being of our population. Absolutely. One question we received earlier from Andrew Seiden, and I'm going to expand it a little bit more, is what, you know, we have experts today here from both the CDC and the US military, and y'all are experts in your area and bring a wealth of knowledge to the different programs that you work on. But the question from Andrew is, to what extent do these climate change initiatives from the military, and we'll also add the CDC, overlap with the goals and initiatives of other public health agencies and other work within the government?
So I can kick off, if that's okay, David.
Yeah, go ahead, Claudia.
So I can speak, you know, from the CDC Climate Health Programs perspective. We work closely with an interagency work group that includes representatives from EPA, USAID, USDA, all the, you know, acronyms, alphabet soup in the federal government, to coordinate climate and health initiatives. So I think a big, you know, product and what they're most known for is the National Climate Assessment. And they specifically did a climate and health assessment in 2016 as well. And this working group really aims to communicate what's going on across the different agencies. And then that National Climate Assessment really is the voice of the government on this across it's been cleared through all the agencies. It's a singular voice on this. So I'd say there is a lot of coordination there. We can always do better. It's a very large entity. But I think that that's been a great initiative to help coordinate the voice and the initiatives on this.
Yeah, I think I'll piggyback on that some. Not so much coordination, but in terms of translation of what we've learned in the Army to outside the military. For example, actually, I've been invited in October. I'm going to be serving on pardon me, it is the end of October. In December, this year's been something else. In December, I'll be serving on a panel at the University of Connecticut. They're working on heat stress guidelines in industrial workers. If you go and look at the American College of Sports Medicine guidelines for heat illness and training and competition, or the National Athletic Training Association's position statement on heat illness, or a number of others, if you look closely at both the people who co-author some of those policies and whose research forms the foundation of those, is a strong military influence. A lot of what we've learned about the physiology and risk factors and whatnot when it comes to human health and performance and heat stress directly applies to that high school football player doing 2-a-days in August in Georgia.
Right.
And it's good to see that some of the work we've done, actually a fair amount of work that we've done, has been translated into those sorts of policy documents that can help protect athletes and others in the civilian sector.
Got it. Wonderful. I think we have time for one more question for the whole panel. The Georgia Climate Project, our big focus, our two questions that we always pose is, what does a changing climate mean for Georgia and what can we do about it? Today, we've heard a lot of answers to that first question about what does a changing climate mean for Georgians' health. We've heard about heat illness. We've heard about pediatric impacts. We've heard about heat. We've heard about so many different things and how a lot of these impacts are exacerbated by existing inequalities within our healthcare system. Looking forward to the next 10 years, what would you recommend for how Georgia can respond to these impacts? So this is the what do we do about it question.
Well,
Go ahead.
go ahead. I was going to say, go ahead, Dr. Walden.
No, well, I'm just going to say, I'm going to continue to emphasize, we must have health care for everybody. We must have health equity so that everybody has the same opportunity to have access to health care and to be healthy. And until that happens, racism, climate justice, injustices, there'll continue to be climate injustices because of the racial injustices. And unfortunately, there is no vaccine for racism. It's something we have to do ourselves. So let's take a change of heart. Let's pray more, because prayer is still our most powerful weapon. I don't care what anyone says, and get more connected with God, because He is still in control. Thank you.
Thank you, Dr. Walden. Lieutenant Colonel DeGroot.
Yeah, so I was just going to say, unlike, and I fully appreciate Dr. Walden's perspective, we're lucky in the military. Everybody has health care. That's not an issue for us. For me, speaking somewhat selfishly, the Heat Center and all of our initiative, we're existing right now on year-to-year funding, what we jokingly refer to as budget scraps, as there's leftovers here and there, and it's cobbled together, and we're continually funded. That one of my goals as the director is to establish long-term, enduring funding for the Heat Center, so that when the time comes when my Army career comes to an end, or the Army says it's time for me to go somewhere else, there's an enduring program that continues to try and continue the mission that we've been carrying on since we arrived. Right now, we're not at that point. Everything right now is temporary, if you will. The Army saying is, you don't have a program until you have a budget. I don't have a budget. And right now, the way just the federal government process works, Uncle Sam is working on building the budget request for federal fiscal year 23.
Wow.
I mean, we just started fiscal year 21 this month. Remember, federal year starts in October. So we're still looking 2 years out before we even have enduring funding. Because I do think we are making a difference at Fort Benning, and the potential to have impact across the Department of Defense with getting knowledge of those best practices out there. But with the uncertainty of whether in 5 years this program is going to exist, makes things tough. So that's my selfish perspective on it.
And also, as an organization, all the organizations that's been represented, which have been great, we really got to do more education in our community to educate them about climate change, because many people have no idea the impact that it has on our health. So more education needs to be done in the communities, in the newspapers, on the radio, on the television, whatever way possible. We have got to do more to educate our people if we want to see change happen. It is not going to happen without that.
I I totally agree with Dr. Walden on that one. And I think sticking with the theme for today, part of that is educating the healthcare workforce for the challenges that we're going to see and the challenges this is going to pose to healthcare delivery. And this is something that we've not had to do, and we need to step it up. It's definitely something that we can start to do more. But again, as Dr. Walden was saying, and as you guys have all referenced, this is kind of an all hands on deck type scenario. So I think we're really good at talking to each other. Everyone who's here knows this is a problem, is already attuned to it. But we need to be able to convince people for whom this is not really something they think about every day, that what they do matters and that we all have a role to play here.
Thank you.
And then I'll just add, you know, I think coming from the CDC perspective, where we've been seeing climate change be addressed and its health effects across the U.S., you know, there really isn't a silver bullet solution here. And I think that the work that the Georgia Drawdown is doing actually to assess what is going to be the greatest risk and have the greatest potential impact in Georgia is really critical. And I think that that will help communicate that to decision makers. And this needs to be made a priority. You know, as we've seen in public health, we're not always preparing as much as we should be, and we're sometimes responding to crises. And this isn't something that we can really respond to. It's something that needs the preparation and needs to be acted on now. So I'll just leave it with that.
Thank you. Thanks, Claudia. I think that's a great note to leave us on and inspire us all to figure out how we can work on this. And I like that there's really no silver bullet. This is going to take a lot of different perspectives and expertise and people to really make this work on this impact and work on how we can safeguard the health of Georgians throughout the state. So thank you so much. I know we can't get a warm round of applause from the audience to thank all of our panelists for attending today, but thank you so much. We really do appreciate you coming on and sharing your time with all of us. It has been a really wonderful, wonderful hour and a half. So for all of the participants who are on the line, thank you again for attending today. If you weren't able to stay for all of it or would like to share this, we are going to be posting a recording from today's webinar on our YouTube page, and we'll be advertising that through our email and on our website. So please stay tuned for all of that. And we do encourage you to let us know how today's webinar was. There'll be a feedback survey that'll pop up after you close out of this window, and another one that'll go out through email. So thank you again to everyone. And thank you again to the team at Georgia Climate Project who helped make this possible. Daniel Rockberg, Claudia, Jill, thank you so much. And Brandon Ellis for IT support. This has been wonderful. And thank you again to our panelists. And thanks for coming. Have a great Wednesday, everyone.